Next speaker is Carole Lewis from Aesthetic Eyes, Inc., operates a well-established second-generation ocularistry practice in Beverly Hills, California. During her career, she has achieved triple board certification in internal medicine, ocularistry, and anaplastology. She will be presenting today on non-surgical periorbital completion.
Thank you, Tony. Thank you, Dr. Tao. And thank you, Dr. Goldberg, who has been a pioneer and provided the genesis for this paper or presentation for over a decade. So, welcome, fellow ocularists and oculoplastic surgeons. And please buckle your seatbelts for a very exciting 6-minute overview of non-surgical periorbital completion. How do oculoplastic surgeons best work with us as ocularists to achieve this level of naturalness? We know you're very gifted. We know that you're highly trained in both reconstructive and foundational work, and you set the stage for us to do excellent prosthetic eye service. Our next level of collaboration begins with an understanding of what non-surgical techniques we can use following the delivery of a prosthesis. This young woman who has von Hippel-Lindau syndrome, to whom she has lost, it's an ocular cancer, she's lost both her father and her grandmother, is fast-tracked to become a TV anchor woman. Please observe 4 enhancements following the delivery of her prosthesis. We have neuromodulators, fillers, threads, and glam topicals. This presentation is just going to focus on the effective placement of fillers following the delivery of a prosthetic eye. Let me go back. I do have financial interest in this, sorry. You're going to be seeing my patented digital iris technology dramatically enhanced by these outstanding oculoplastic surgeons. When we encounter residual lower lid laxity, hyaluronic acids are reversible, and these are very effective when placed along the infraorbital rim. We can get cosmesis, better distribution of tears, and less GPC in the inferior cul-de-sac. When we have residual ectropion, we can reverse to a normal curvature once again with this same methodology. Both of these patients were delighted with this level of completion and that they could immediately board their planes home to Europe. When we encounter superior blepharosulcation, again, beautifully, effectively handled with fillers that have different molecular size particles, and these are hydrophilic. They'll pull the moisture in over 24 to 48 hours. This is my personal favorite use of fillers, and I've coined it upper lid gender disparity. So please observe, as I'm delivering this prosthesis, I have a heavy upper lid, and the lash to crease ratio is disproportionate to his companion's side. This side is really more feminizing in that we ladies like to add shadow in this area, but this is in contrast to his more masculine hooded lid. Within a lunch hour, using both neuromodulators and fillers, we're able to create strong masculine symmetry. My youngest patient to receive fillers is a 10-year-old boy, post-BB gun accident. And his parents are adamant there be no surgical intervention, but he requires a very prominent prosthesis. So in his case, we use two-stage filling, inferiorly and then superiorly. This young man was in our waiting room sitting next to an adult who is perspiring and actually moving the chair because he's so anxious. And he's talking to this 10-year-old about injections around the eyes. He graciously allows the 10-year-old boy to go first, and the 10-year-old boy returns to the waiting room. He puts a thumb up, he gives a big smile, and he goes, POC. He can tell the guy is bewildered, so then he smiles even more. He now puts two thumbs up and goes, piece of cake. My most complex case is a professional, actually a lady physician, and she's reticent to take time off for the staging of reconstructive procedures. And she was absolutely delighted with the creativity of oculoplastic surgeons to use a combination now of fillers to give her this level of symmetry and around her Asian eyes. The takeaway that I want everybody to get here today is that fillers are a wonderland. Once the patients see that you can correct a defect around the eyes, they go from looking periorbitally to panfacially. And this is what I was hoping to share with you in my opening slide of that young woman. The greatest seekers of these services are the ones holding their cell phones, the selfie generation, the millennials. They will step up just like that for a treatment very quickly. And please do not overlook the young men. They are equal seekers of these services. Something very exciting for us, and we have, when we have a very refined patient who now notices the brows are not quite symmetric, non-surgically, we can use these PDO threads, which are actually sutures with cogs, and we can lift and provide collagenesis. This, again, done over a lunch hour. In contrast to fillers, these are so valuable to our monocular patients because there is no chance of blindness, tissue necrosis, or stroke. We have reviewed the effective placement of fillers and the most requested areas for fillers periorbitally. And I've given you a glimpse into the unique value of threads for our monocular patients. With these non-surgical techniques, our next level of collaboration with oculoplastic surgeons will give our patients increased satisfaction, increased confidence, and increased naturalness. For enhancements that I've not reviewed tonight, please feel free to visit our Aesthetic Eye website. And I thank you all very, very kindly.